Getting an ALS diagnosis is, well, it's overwhelming enough. The last thing you need is to be staring down a six-figure price tag for your treatment. But here's the thing. What if I told you those crazy, scary costs could actually be brought down, way down, maybe even to zero? That's exactly what we're going to explore today. We're going to break down the real numbers and show you a clear step-by-step path to making these life-changing medications truly affordable. So here's how we're going to break it down. First, we'll tackle that initial sticker shock head-on. Then we'll get into how your insurance really works. It's your first line of defense. After that, we'll uncover this incredible network of patient assistance programs. Then I'll give you a simple financial action plan. And finally, we'll look at the bottom line, what you can actually realistically expect to pay. All right, so let's just dive right in and talk about the numbers that cause so much anxiety. Because let's be honest, the list prices for these new ALS drugs are enough to take your breath away. First up, one of the main treatments. So that's the ballpark annual list price for the oral version of Radicava. This is a really key treatment that, for some patients, can slow down the progression of ALS by about a third. This is the big, scary number you see in the headlines. And check this out. This was the annual list price for Relyvrio before the company decided to pull it from the market. Now, the good news is patients who were already on it can keep getting it for free, but a price point like this just shows you the trend for new therapies coming out. Okay, so when you put it all together on a chart like this, you really start to see something interesting. You've got these powerful new drugs like Radicava and Qalsody that are way up in the six-figure range. But then, way down at the bottom, you have the much older generic drug, Riluzole, for under $10,000 a year. This huge gap is our first clue that the list price isn't the whole story, not even close. So you see those giant price tags, and you're probably thinking, how on earth do I fight that? Well, your first and most important shield is your insurance. But as you're about to see, that shield can have some gaps you really need to know about. Think of your insurance as your primary tool for covering the bulk of the cost, but, and this is a big but, it's not a complete wall. You're almost always on the hook for a piece of it. That comes in the form of things like your deductible, and then either a fixed fee called a copay, or a percentage of the total cost, which is called coinsurance. Okay, let's make this real. Look at infused drugs, things like the IV version of Radicava under Medicare Part B. Medicare pays 80%, which sounds great. The problem? You're responsible for the other 20%. And 20% of a drug that costs $145,000 a year is still almost $30,000. That's a huge, huge gap. But, and this is so important, you don't necessarily have to pay that 20% out of your own pocket. A supplemental plan, what people often call a Medigap plan, is specifically designed to cover that coinsurance. This makes it an absolutely essential piece of the puzzle for a lot of patients. Okay, what about oral drugs, things you take by mouth, like the pill version of Radicava? For that, we're talking about Medicare Part D. And listen up, because there is a massive, game-changing update coming in 2025. You'll pay your deductible and your coinsurance until you've spent $2,000 out of pocket. And after that, your cost for all your covered drugs drops to zero. For the rest of the year, it's a hard cap, a real safety net. All right, insurance is a huge help. We've got that. But what about those gaps we talked about? The deductibles, the copays. This is where the magic really happens. This is where a powerful but kind of hidden network of support programs steps in to close those final financial gaps for you. This whole support network, you can really think of it as resting on three main pillars. First, you've got programs run directly by the drug companies themselves. Second, there are independent nonprofit charities. And third, there are government aid programs for people with limited income. Now let's zoom in on the two biggest players in this game, because this is where you'll likely find the most help. On one side, you've got patient assistance programs, or PAPs. These are run by the drug company. On the other side, you have nonprofit foundations like the PAN Foundation. The company program is all about their one specific drug, while the nonprofits can offer grants that are a bit more flexible. Sometimes they even help with your insurance premiums. Let's make this super concrete. Take the JourneyMate program. That's the one for Radicava. If you have commercial insurance, they can give you a copay card that literally brings your costs down to zero. And what if you're uninsured or your insurance doesn't cover enough? If you meet their income rules, they might just give you the drug for free. Period. Okay, this is all fantastic, right? But you're probably wondering, so what do I actually do? How do I get this help? It can seem really complicated, so let's walk through a very clear 4-step action plan to get you there. Seriously, if you follow these steps in this order, you're building your financial support system brick by brick. You have to start with the drug company's own program. They're the experts on their drug and how to get it paid for. Step 2, layer on top of that by looking for nonprofit grants. Step 3, if you have limited income, look into government programs like Extra Help. And number 4, and this is crucial, never, ever take no from an insurance company as the final answer. There are entire organizations that exist just to help you fight denials. So, after all that, what's the bottom line? What does this all mean for your wallet? Let's look at the night and day difference this action plan can make. We'll put the costs side by side, with assistance and without it. I mean, just look at this. It's basically 2 completely different realities. On the left, you've got those terrifying numbers we started with, nearly 29 grand a year, or even the full 171 grand if you're uninsured. But then, look at the right side. This is the new reality when you tap into that network. With a Medigap plan, with manufacturer assistance, with nonprofit grants, every single one of those costs can potentially be brought all the way down to 0. So what's the big takeaway from all this? It's simple, really. That giant 6-figure price tag you see on the news, that's almost never what a patient actually has to pay. By strategically combining your insurance plan with these amazing assistance programs, getting the medicine you need for little to no cost isn't just a dream. It's a very, very real goal for so many people. And that kind of brings us to one last big picture thought to leave you with. It's absolutely incredible that this whole safety net exists to help people, but it also makes you ask a bigger question, right? Is a system that requires this much work, this much navigation, just to make a life-saving drug affordable, is that a system that's truly working? Or is it maybe a sign that something, somewhere, is fundamentally broken?